I guess in some ways for me, and I don't know for you, like it's important, like you did your own research, right? Which is great. You're aware of this, but I think a lot of people are not, right? Like they feel overwhelmed, they freak out, they leave, they don't have the money, or they don't feel like they should be spending all that money on that, which makes sense. So is it if I'm needing assistance, right, with my like medication costs, right? And I'm HIV positive, like what do you think? Is it pharmacies that would know? Is it clinics that would know? Or is it kind of
pharmacies would know a lot of the time. I think it honestly a lot of different I guess programs know about these other programs. I think that's where the importance comes of like programs like ours that we worked in, medical care coordination, because it's sort of like a pool of resources that you kind of just pull out of to help facilitate the care of the patient. That's why these programs tend to be important. But I think from experience, pharmacy tends to know most of how to access those programs.
I agree. I think that's what you've seen. And I think it's important to, if you are HIV positive or if you are interested in PrEP, like it's important to go to a clinic that like is really well aware of like programs that are there for you, programs there, but also like it's important to go somewhere that knows about resources or at least can link you somewhere, right? And I don't know for you, but like I always have seen like when we've seen like clients go to just like an everyday pharmacy and nothing's wrong with that, and they have all these like issues that come up because maybe there's challenges around that, but you go to a pharmacy at like maybe Northeast Valley, the LA LGBT Center, Men's Health, like they definitely are more aware and equipped to help you kind of meet those needs better in a really trauma-informed way, at least in my experience in these places. I don't know if that's something you agree with, if you have another suggestion.
I mean, I totally agree with you. But I mean, ultimately, just somewhere that you're comfortable.
Absolutely. You're right.
If you're not comfortable being at this particular clinic, if you're not comfortable with the doctor, if you're not comfortable with something, then chances are you probably won't go back. So, I mean, that's like, just be comfortable for sure, and make sure that you feel like they're well equipped to take care of you.
And you're 100% right. From the person that's working in your MCC team to the person that you're seeing as an MA to the doctor to the pharmacy, like you need to feel well cared for, is what you're saying, and comfortable and safe. Those are primary needs. For anyone, I think, especially those of us that are like diagnosed with HIV, struggling with mental health, like anything, I think it's important.
Absolutely.
So.